We're told that alcohol should be considered a risk factor for cancer and that we should always drink in moderation. But what does it mean to drink in moderation? Dr. Michael Pollak is the director of Cancer Prevention Center at the Jewish General Hospital. And thank you so much for joining us, Dr. Pollak.
It's a pleasure.
So smoking, being overweight, not exercising, we've all been told that is considered a health risk. It's fairly recent, though, that we're starting to be told that alcohol has been added to that list. So what has changed?
Actually, we're trying to get the message out. The knowledge that excess alcohol can cause increased cancer risk is not that new. It's just not being well enough publicized. And really, to avoid excess cancer risk, people should have drinks perhaps once or twice a week, not once or twice a day.
And I guess the difficulty here is when you talk about risk factors are difficult to understand because it doesn't mean that everyone who drinks a lot is going to get cancer.
Absolutely. It's like speeding on the highway. Some people speed on the highway and don't have accidents. Some people drive slowly and do have accidents. But if you look at thousands of drivers, it's absolutely clear that speeding is dangerous. Same thing with alcohol and cancer. If you want to lower risks, you have to keep your consumption down to 1 or 2 drinks a week. And we're tired as oncologists of facing patients after a diagnosis of cancer who tell us we never knew.
I guess we were sort of lulled into a false sense of security because we all heard the stories about, how moderate drinking might actually be good for us. And so we believe that.
Yeah, people have to look at overall health outcomes. There was some data that for heart disease, a small amount of alcohol consumption might be beneficial. That now is not something that we're so confident in. But the risks for cancer from excess drinking are greater than any protective effect that might exist for the heart. So really, people never understood what a reasonable amount of alcohol is. And recently, the Canadian government actually surveyed the number of people of legal drinking age in Canada and looked at that in the context of the amount of alcohol sold in the country. And the amount of alcohol sold in Canada more or less would allow every Canadian of drinking age to drink 9 drinks a week. And statistics are certain that increases cancer burden, particularly cancer of the breast and also cancer of the throat.
Though we tend not to associate alcohol with breast cancer. There is a link, though. I mean, do we know why?
Yes, it's very interesting, and it's been more or less proven now that when the body tries to detoxify alcohol, which it's really chemically known as ethanol, it produces a compound called acetaldehyde. And that compound can be damaging to DNA in a way that can increase cancer risk. So we know precisely why alcohol does this. In the case of breast cancer, it also alters the physiology of the hormone estrogen, which can also increase specifically breast cancer risk. So we know the facts in terms of the biochemistry. We also know the population statistics. And we really have to prevent every case of cancer that can be prevented. Of course, we realize that not every case of cancer can be prevented, but it just is frustrating to have people after a diagnosis of cancer let us know that they're so surprised. They had no family history, they don't smoke, they exercise regularly. And then we ask, what about alcohol? And some people have a mistaken belief. They say, no, couldn't be alcohol. I never drink more than a bottle of wine a day. And they simply don't know that this risk factor exists. And had they known, might have had a more healthy lifestyle. So we're not prohibitionists. You can always have a drink once or twice a week to celebrate, but the notion of what is safe has to be made more clear.
Well, you were going to be giving a talk about alcohol and cancer this coming Saturday at the Jewish General Hospital to make it clear what it is that you're telling us, which is very important. It's called the Toast to Prevention, the Wine Experience. And again, it's Saturday, October 25th, starting at 6 o'clock at the Jewish General Hospital. And thank you so much for taking time out.
And we'll be serving alcohol-free wine and beer.
Of course. Thank you so much for taking time out to speak to us today.
It's a pleasure.